Hello, everyone. Welcome to the Healthier You with Wendy show, a guide to living a healthy, active, and productive life. Today, we have a very special guest here with us, Dr. Louis Wong, family medicine physician at Providence Medical Group here in Southern California. Welcome.
Thank you for having me. I feel very honored to be on your show.
Thank you. Alana, why don't you tell us what we're talking about today?
So today we're going to talk about obesity. I'm sure many of you guys out there listening or viewing us are well aware of kind of the numbers of obesity here in America among adults as well as children. So I kind of want to turn the question to you and first just kind of describe what does being obese mean? What does it mean to be overweight? And how do you determine that when you're looking at a patient?
So overweight and obesity are defined differently among the different ethnic group and also different cultures and different regions. By medical definition of obesity and overweight are defined by weight divided by height squared in metric system. Sounds a little complicated, but there are iPhone apps to help you out with it. Basically, the number and the calculation that we came up with is that 18 to 25 as a solution of the BMI, body mass index, is defined by 18 by 25 as normal weight, and 18 or below are underweight, and 25 to 30 are defined as overweight, and 30 or above is defined as obesity.
Interesting. So I guess why do I need to care about what my BMI is?
As we understand that increased obesity basically increase your risk for multiple preventable death-related disease in the United States. And these diseases are basically including cardiovascular, diabetes, type 2 diabetes, and certain types of cancer, and even infertility in women.
So who are at risk when it comes to obesity?
Essentially, everybody is at risk for obesity, and certain ethnic group and certain age group are a little bit more prone to obesity in the United States.
So what are these certain ethnicity or certain age group who are more prone to obesity?
I would tend to treat every patient equally and screen everybody for obesity instead of targeting certain ethnic group, because disease don't identify ethnic group and cultures.
Interesting. So when you have a patient that comes in and you've identified them to be, let's say, obese, kind of what actions do you take right then, and what do you recommend to your patient to start doing to really try to get to a healthier weight?
Okay. With regard to patients who come in with problems with their weight, I tend to bring out the problems on the very first visit. I don't usually like to so-called quote-unquote sugarcoat their weight problem. I just like to tell them directly, hey, there's a problem and we need to try to fix it, and sense how patient is to deal with this weight problem that he or she has.
So what are the most common problems when it comes to obesity here in Southern California?
Common problem as far as comorbidities associated with obesity is basically sleep apnea and diabetes are very common, and cardiovascular disease such as heart attack and congestive heart failure. Is
obesity a problem across the board?
I definitely agree with that. Obesity starts in childhood, and diet control and exercise definitely a first start to deal with children's obesity problem.
So so you briefly mentioned about diet, exercise. So how do we solve obesity as a problem? How do we approach that?
Well, first thing first, I'd like to talk about childhood obesity. Is defined a little differently from adult obesity. It's defined by a growth chart instead of the body mass index that we usually apply it on adults. And as far as the approach to treat obesity in childhood, obviously there's physical activities as well as diet to begin with.
So when you say physical exercise and diet, are there any recommendations?
As far as recommendations for across the board, 150 minutes of
wow.
It is 150 minutes. It is.
I don't know.
Per week. Is the recommended amount of time for somebody who's who's having weight problem. Even for someone who has normal weight, it's a good way of maintaining body weight, and also for a healthier lifestyle. And 150 minutes be divided by 5 days. That's 30 minutes per day, and it's only intermediate vigorosity exercise.
I see. What are some of the little things that we could do on a daily basis to make sure that we're going towards that goal?
My approach to diet control for treating or managing overweight and obesity is basically eating less than eating more. Calorie count is one, as far as looking into the back of your food labels to see how many calories you're taking in, and cutting out all the soda and all the empty calories that people usually take on a daily basis.
So when you say empty calories, what are the most common empty calories that we take in on a daily basis?
I would say number one would be the soda intake.
Okay, so no more soda. I'm going to clean out my fridge then.
Soda is definitely number one. Certain amount of artificial drinks such as juices and some sports drink as well.
Are there certain types of food that maybe would help you feel a little bit more full that you recommend to patients when they're trying to lose a little bit of weight?
When there is a little bit of weight problem, I highly recommend patients to start replacing certain amount of food they take with steamed vegetables.
Okay.
Steamed vegetables essentially have very low calorie count as compared to rice, noodles, or proteins.
So what are some examples of simple things when it comes to monitoring our diet?
I would say buying a scale and put a scale in your bathroom, and every morning weigh yourself and kind of monitor your weight every single day. People tend to become a little bit more conscious about their weight when they have a scale at home.
Interesting. Okay, that's the first thing I'm going to do when I get home today. Buy a new scale, invest in the future. Now, what about drinks when it comes to drinks? Is there any recommendation?
I recommend drinks that are unsweetened. Basically, look at the food label to see if there's any calorie in your drinks. I highly recommend drinking more water than anything else on a daily basis.
What about alcohol intake? Because I know,
Good question.
I mean, it's a reality. You want to be social and stuff like that. I mean, what are your recommendations around alcohol intake?
Alcohol intake, basically, depending on what type of alcohol you're taking, you're talking about beer, whereas I consider beer as liquid bread. You are taking you're taking in bread in a liquid form, and of course, bread has a high amount of carbohydrate and high amount of calorie in it. So. Everything in moderate level would be very helpful as far as alcohol intake, and that's another set of argument and discussion. And obviously, I don't recommend drinking excessive amount of alcohol on a daily basis.
So kind of to see where you're, how much food you're taking in, how much you're drinking. Do you recommend patients to keep a food diary, or what are some of the other ways they can kind of become more aware of what their daily intake looks like?
If I'm treating patients with a little bit of weight problem and their weight seems to be elevated regardless of the counseling and also the regular visits in my office, I would tend to ask them to keep a food diary and also consider taking a photo of what they eat every single day, including the drinks they're taking in, to kind of gauge what they're taking and the amount of food they're taking, because measurement of amount of food could be very subjective.
Right. Yeah, you think this is one serving, but in reality it's like 5.
Exactly.
So yeah, it's important to get that good, clear picture of that. Absolutely.
All right, so what about now we've talked about childhood obesity, what about for young professionals? What are some of the things that we have to look at?
My approach for general population, for regardless of young professional or not, is that on a daily basis you should always look out for weight gain, unexplained weight gain, or even weight loss as well, and also exercise on a regular basis, taking as much stairs as you can instead of taking the elevator and escalator, and just do as much physical activity as you can to monitor your cardiovascular health and to maintain your capacity of exercise.
Now, do you have any tips when it comes to increasing physical exercise?
My approach, as far as low cost or no cost approach to exercise and weight maintenance, is taking the stairs. I often recommend my patients to take the stairs. At the end of the day, take stairs for 20 times. Up and down counts as one time, so there's no cheating there.
Okay.
Up and down counts as one time, taking 20 times of stairs, 20 to 50 times or as much as you can tolerate, and that would definitely burn off some of the excess amount of energy that you take in on this everyday basis, and that would definitely there will definitely be a proof of weight loss in a long-term goal. Okay, with a long-term goal. Mm-hmm.
It's something I recently heard was they said sitting is the new smoking.
Oh, yes. I was about to bring that up, too.
Mm-hmm. Right. Smoking or sitting, like what we're doing today, is sitting for too long is definitely not recommended for any individual. And I recommend at least go take a walk at the mall or take a walk at the park. Anything is better than sitting, not doing anything and watching TV, except for watching our show.
Yeah.
Right.
Yeah.
That's good. Remember that. That's a good plug.
Mm-hmm.
Now, who are at risk for obesity when we're looking at the older crowd?
Let's put it this way: who are at what kind of? I think the question would be rephrased as what are some of the consequences of obesity in older population. I think that's perhaps a better question to ask. I would tend to think that sleep apnea is a consequence of obesity, and people who are extremely obese and have a basically non-active lifestyles are definitely more prone to the so-called sleep apnea that's correlating with obesity body type.
And one of the things I kind of wanted to get back to is I know that we were kind of talking earlier, and one of the things that you had brought up was this idea of abdominal adiposity. I think
Correct.
that's how you pronounce
Correct.
it. If you could kind of elaborate that and maybe what that could be an indicator of.
Right, abdominal adiposity is basically an indicator of intra-abdominal fat deposits, especially in your organ, in your heart, and mostly in your liver and in your kidneys. And I would define it, I would use my reliable sources definition that it's basically stating that waist circumference in men above 40 inches and above 35 inches in women are defined as obesity, abdominal obesity in either gender.
And what kind of creates that? I mean, kind of the abdominal. Is there anything that you're doing specifically? Is stress potentially related to additional adiposity there, or not really? Those kind of unrelated things.
Stress could. It could be behavioral. It could be environmental. It could be just simply lack of knowledge in nutritional intake, and or just not motivated to help managing one's body weight. That could definitely lead to so-called abdominal adiposity or abdominal obesity.
So what is the most challenging thing when it comes to treating obesity as a problem for providers?
Well, every patient is different, and some of the challenging factors are basically some of the providers, like myself, feel that it is offensive to bring up the obesity topic with patients because patients are often feeling offended by talking about their weight problem. And there are certain patients who are not interested in losing weight, and there are these are basically the top challenges that I have in my daily clinic visits.
I see. So if you could sum up all your recommendations to treating obesity or weight management, what would that short little cheat sheet be like?
Well, my approach to dealing with obesity, as if I was in a research program when I was in residency training, and I was involved in a project called Obesity Clinic, and we often tell our patients that obesity is a problem, not just a body. It's not a body image. It's not a cosmetic approach. It's a risk factor that patients are putting on themselves. The consequence might not be visible within the next 3 years or so, but in the next 20 years, patients would tend to suffer from the consequences that come correlates with the obesity problem.
So what are these consequences?
Consequences are basically, again, reiterate what I mentioned earlier, would be cardiovascular disease, type 2 diabetes, and certain types of cancer, including colon, prostate, and endometrial, even breast cancer. My recommendations, obviously, is calorie count, exercise, and regular visits to your primary care physicians for monitoring of your body weight and also for managing the comorbidities that might be associated with the weight problem.
So I guess one of the questions I have, you probably see your patients maybe for, let's say, like 15 minutes, 20 minutes for a visit. Is that semi-accurate?
Correct.
Correct. Okay. So I guess, the work that you're doing within those 15 minutes, how can the community support your efforts? What kind of changes can we make in schools as well as just kind of the general community as a whole to really kind of create a healthier environment for everybody?
As far as the environment that I'm trying to bring out to the society is that I like to bring out the awareness of obesity and body mass index. I'm not trying to call everybody who's out there who's obese, who's fat or whatnot. I just want to bring out the consequences that are associated with obesity. Patient education, and I often tell my patients come in just to talk about obesity and talk about weight problem, and we can manage the weight problem just based on that 15 minutes of discussion without talking about any problems. Don't wait till you have problems to come to your doctor. You already have a problem, come to your doctor and we'll talk about your weight problem.
Okay. Is there anything that maybe we could be doing kind of like in schools or anything like that? Do you see any changes that need to happen there, like more physical activity or anything like that? Or what are your thoughts about that?
My thoughts about educating the general population starting from day one would be teaching, try to incorporate a little bit of dietitian type of knowledge into our daily education in school, such as what are carbohydrates, what are fatty lipids, what are proteins, to ingrain these knowledge in our kids. And so I think certain classes should be as well worth the investment of the time and money to educate our population about food and about nutrition.
Now, any tips for the parents out there to kind of raise that awareness?
As far as the tips that I give to my to the parents of my patients, I often tell them, hey, limit TV time or video game time, and tell them to go out there and play soccer or play baseball instead of watching TV. So our show again. Instead of watching TV and play video games, and I would also limit on snacking. Try to focus calorie intake on formal meals rather than snacking, and also limit amount of soda intake and juice intake.
Now, when you say limit snacking, now what if sometimes it's hard that we just have to kind of snack a little bit here and there. Now, is there any healthy snack?
As far as healthy snack, I often tell patients, I'm not a dietitian or nutritionist by training, but I often recommend steamed vegetables or something that's low in calorie, like salads or fruits, are a little bit better than processed food and or juices and soda that are highly concentrated in sugar.
What about, I remember hearing a concept called superfood, like blueberries, goji berries, and nuts, and etc. Are any of these good for our kids as an alternative to snacks?
These food are good food in general because they contain a lot of fiber and relatively low in calorie. However, you should do everything in moderation, and just have to monitor the amount of food they're taking in, and also do a little bit of calorie count instead of eating excessive amount of so-called superfood. That also could lead to consequences as well.
Right. Now, I remember hearing about the low-carb diet where where you cut out the bread, the pasta, the pizza, and then some of the red meat, and replace it with more protein, more eggs, and lean meat. Now, what do you think? Is that an effective way of kind of monitoring the problem?
Again, high protein diet or low carb diet, any diet would work if is done in moderation and being monitored by a physician on a regular basis. Excessive amount of protein intake or meat intake might lead to an increase in cholesterol or whatnot. Lack of carbohydrate intake might lead to feeling fatigue and feeling malaise on a daily basis. So I would, my approach is that I recommend a balanced diet and try not to take excessive amount of certain protein, certain meat. Try to keep a balanced diet instead of a specific diet.
Now, are there any food you recommend that are good food for
weight loss?
Right.
Okay. My approach to weight loss or diet control is eating less rather than eating more. So I recommend eating less. But then a lot of times eating less equates to hunger, and I tend to recommend my patients to replace your certain portion of your plate with steamed vegetable that are less in calorie.
And one of the other things I've heard when people are looking at trying to maintain a healthy lifestyle, healthy weight, is this idea of getting enough sleep. How does that kind of factor in, and is that one of the recommendations that you have for your patients as well?
Sleep definitely plays a part in weight gain because of the hormonal changes in your body. But another idea I like to tell my patients that the longer you stay awake, the more hungry times you're going to have. So you tend to snack a little bit more when you're awake more. So good amount of sleep that's just sufficient for each individual is definitely recommended. And my approach is do not eat one more meal when you're awake. Or cut down on snacking as well.
Interesting. Now we talked about stress and food and also drinks. What do you recommend when it comes to drinking water? How much water should we drink on a daily basis?
Drinking water in moderation is what I recommend for all my patients, unless you have underlying kidney or heart disease. There's really no good studies out there showing or telling us how much water to drink, but the amount of water should correlate with the amount of body weight that people have. But there's no good studies out there. So I would tend to think that most of the people in our population are drinking less water than we should. And there's excessive amount of soda intake and juice intake instead of water intake. So I would recommend a little bit more rather than drinking a little bit less.
Right. So now on this topic, to piggyback on drinks and water, what about coffee? I mean, I know that. Right. My day, honestly, to be frank, my day does not start without coffee. And what are your thoughts on that?
My thoughts about coffee. Hey, again, I mean, from being a healthcare professional, I live on coffee, and most of my colleagues drink coffee on a daily basis. I'm not against coffee, but if you can cut down on the excessive amount of sugar you put in your coffee and excessive amount of high-fat creamer in your coffee, that will be very helpful.
Okay, so black coffee only, no sugar, no creamer.
Not necessarily, but in moderation.
Okay, moderation.
Yeah, I was also wondering, we're talking about nutrition, but then also kind of getting discussion of physical activity, because that's also another component that you spoke about. I'm actually someone who has bad knees. Do you have any recommendations for people who maybe they need to find some type of physical activity that isn't as weight-bearing, perhaps? Or do you have recommendations for people like me?
I would tend to recommend swimming. Put a little bit less pressure on your knees. And stairs, stationary bikes are also good approaches to exercise. Okay.
Now I know that when we try to approach the problem of obesity, discipline often comes up. And what are some of the little things we could do to solve that problem?
As far as discipline goes, I think it's a personal approach, and my approach to preaching my patients about diet control and exercise would be explaining what the consequences of obesity and the disease that are associated with the obese and overweight. And I tend to encourage them when they have at least a minimum of 5-pound weight loss. So I tend to encourage them when they do something right, and scare them about the disease process that are associated with obesity. So that's my approach.
Oh, that's great! Wow. So That's a lot of notes that I'm taking down in my head. So first thing, you need to invest in the weight scale. Go out there, go buy a nice one.
You don't have to get a nice one, just one.
One that works. And before you eat each meal, take a picture of your food so that it gives you a mental idea of how much you're eating.
You can also show your physician what you're eating as well.
Oh, okay.
And show your dietitian.
Just upload it to Instagram, tweet it out.
and drink lots of water. With coffee, you could drink coffee, but try to lower the sugar and the creamer. And then limit soda intake. It's hard. I know it's hard. And also juice. I know sometimes we're told that juice is good, but try to limit soda and juice and some of these high sugar, high salt food items. And thank you so much, Dr. Wong, for sharing with us about obesity, about weight management, and we'll be coming back and bug you again. And for the audience watching, thank you for tuning in.